development happens in this field and see how it cuts costs and everything. So definitely an interesting emerging area. Can I just have a quick show of hands to see if anyone has any burning questions left? Okay, maybe not burning questions, but any questions left that you might want to ask, because we might take the last round and then we'll let our panelists have the final round of remarks and then we'll call it a day. Any quick questions, comments, thoughts? Yes.
I just wanted to follow up on the availability and the sharing of the data, which is so important, because in Hong Kong, the major supplier of these drugs in a very systematic way is the public hospital system. And they also have a very good system which they have used for over 30 years. And it has all the data, consumption, prescribing practice, linked to demographics and geographical areas and hospital readmissions. All those are inside the hospital authorities and computer system. But nobody can use that data at all. And they say that that data belongs to individual patients. And so those data aggregated, even if anonymously, they cannot disclose the data. But although they do not disclose the data, the pharmaceutical companies do know how much inhaler, a certain brand of inhaler they have supplied to the hospitals, all right? So from the supplier side, they still know how much the hospital authority has bought. For example, certain brand of paracetamol. So, you know, when these data were presented to the mother manufacturer country, for example, Ventolin, salbutamol inhaler, Ventolin. So GSK used to own that brand. And when the GSK has to, you know, supply to meet the tender requirement of the hospital authority, the people in the UK were shocked. Are those people in Hong Kong so sick? How come they consume so many inhalers? Is not proportional to the population of patients that they anticipate. And it is because the inhalers were wasted. They were not consumed. The patients were given 4 and 5 inhalers in one go, but when they go home, they don't know how to inhale, and they become admitted, and the doctor gave you another 4 and 5, and the patient end up with a dozen of them at home. You know, they can play with it, but they don't use it. All right? So the total consumption exceeds the normal inhaler that should be consumed by a normal population of patients. So data is not used to monitor the quality use of medicine, and it added cost unnecessarily. So a better future for access to medicine does not only cover the patent and management, does not cover only the price control. It's a whole spectrum of activities, and from the source to the consumption and the patient education and the role of the pharmacists and the nurses and other the practitioners. But this is altogether neglected. So I think this has been a great conference, because, you know, we were able to, you know, from different backgrounds, we are able to share this view. But we need to be much better in making sure that there is better future access to do a lot of things in a lot of areas. You know, it has been great talking about patent.
No problem. Thank you so much, Ms. Zhang. I think it's also a good roundup, and then we'll lead to the final remarks. Just an update from our team, because there is tear gas released at the gooseneck, so around the Causeway Bay side. So when you leave, definitely check all updates. Guests, don't worry, well, you're in good hands. But try to, so excited. Take her to the front line with the helmet. So try to, special tour. Try to avoid gooseneck and also Hennessy. So everywhere else, or maybe the ferry and everything. So if there's tear gas, then don't panic. You know, take out handkerchief, you know, everything, protect yourself, you know, all that. So I'm sure you all know, because you're all, you know, a lot of healthcare professionals. But do take care. So on that note, we'll just leave maybe 1 minute each Coming back to actionable steps, is there any pointers or any advice for our audience today if we're interested in pushing forward affordable medicines in Hong Kong? One tip or action from each of you. Yes.
All right. Since I have the microphone, I'm going to ignore you for a second and just respond. It's the data. Actually, just to go back there, we really should we have the tools now. We have the data. We need to use the tools. But actually, we're kind of putting prohibitions in our way as well. Story: I was in Europe, and the bag didn't come off the plane. And everything is chipped now, right? They know exactly where the bag is. But I had to switch airlines, and airlines said, yes, they know where your bag is, but they can't tell us where the bag is, and therefore I can't tell you where the bag is. But the other company knows where the bag is. So this is data. They know where my bag is, but I can't tell you because someone else can't tell me, because there's protection laws. For whose protection? Mine, right? And so that it's really, again, we're kind of making laws without looking at what the result is. So in the health field, obviously, we need to make sure that we can use, to anonymize that data is going to be very easy. This is ridiculous that we're not using it. The point, access to medicines, I'm actually not bullish. I'm bearish because in my talk on where we're going with kind of trade agreements, and I'm for trade agreements. I used to be a negotiator. I'm for trade agreements, but it's just restriction, restriction, restriction. And then after the fact, if we, and I'd like you to comment on this when it's your turn, if then we say no, this is the wrong approach, can we actually then change the law because we've kind of put handcuffs on ourselves, and especially those countries who are they now want to pull back. They've proliferated a model, it's going to be very difficult to pull back. And so the future of access to medicine, I hope we can actually still include that word better in there. So I think there's still hope here because we haven't really agreed to so many onerous conditions. But that's the worry, is if we do it, can we pull back? Otherwise, holistic review.
Professor Lee, 1 minute. 1 minute.
Yeah, I will again emphasize the importance of medical AI. I think the government, Hong Kong government, should pay attention to this and also should invest in this area. Otherwise, maybe 5 or 10 years later, we'll see that in Hong Kong we are still doing whatever we have been doing for the past 50 years, and the rest of the world already started to use AI in the medical area, doing all sorts of the sense, and particularly you talking about the access to medicine. As I said, if the AI can help to lower the cost and in every juncture of R&D and also the medical service, then that will solve a lot of problems. And so if we don't catch up right now, we will be left behind, and we'll be regret. I think in a few years later, when you look back, why don't we take action earlier?
Warning from Professor Lee. Yes, final minute.
Well, very, very quick. I absolutely agree with you that improving health and improving access to medicine, it's not just access, it is rational use, which often also means not using them at all or using them wisely, is key, and there's a lot of savings to be done there. The use of data and the transparency required to actually have access to data is key. I'll tell you a little story of the time of drug procurement at the time when the Global Fund demanded countries to also report the pricing that they were paying. And there was this common belief that the large countries could do better economies of scale, blah, 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 but actually the best price was obtained in Togo. Tiny country. So they looked into it. I thought, what's going on here? How come Togo? Well, there was this one person responsible for procurement, an intelligent person who used the data, who knew exactly where the good prices were and went after it. Smart procurement. That's what he did. It was actually fairly simple, but he used the database. He used the database to identify the affordable sources. But I want to hammer on the point of transparency. There is, on the one hand, to drive for greatest transparency. There's also a movement against it. I would also recommend those of you working on these issues to hook up internationally, because there is internationally also a movement on a lot of these issues that will help create conditions for better access to medicines. And we have to protect the access to treatment, because we're still talking about sort of the old situations where medicines are products, but what we now see is the appropriation of the act of medicine itself. And there I would plead, particularly with those of you in the medical profession, to join forces and act up against that.
Joining forces. So on this note, I invite us all to have a great round of applause to our panelists. Thank you so much. Thank you so much. Dr. Fan, any last words for the 2 days?
30 seconds. No matter what we discuss now about rational use, accessibility, data, AI, all are very important. But finally, I think it's related to ownership. Who finally own the data, who finally own the right, or who know what to do, I think is everyone of us should be the one who take action. We have to understand more. We have to have the literacy, not only about health, but literacy related to how we can fully develop our potential to be healthy. This is one thing. The second is we cannot work alone. What I mean work alone is you cannot, as an individual, try to do your best, can fully develop your potential. You need your family. You need to have a neighborhood. You need to have a good working environment, and also have a good community, and to find good companion like HIA, Health in Action. We have to work together to make a better future. And so if you are still not a fan of HIA, please follow us. And I promise you, no matter how difficult it is, next year we try to have a health equity conference in Hong Kong. And of course, access to medicine or things related to this will be one of the topic. Again, yeah, okay. Sam, we can still go on. Yeah, okay. Yeah. So be safe, and then we'll meet again soon in coming future. Okay, I don't want to delay because they are really coming. Yeah. If you want to have another good experience, we can go down slowly. Yeah. Okay. Thanks to you. Yeah, thank you everyone.